All right, good afternoon, everybody. Thanks for joining us on a Saturday. Really appreciate it. As you likely know already, the governor just had a press conference before this, and I'm going to expand on a little bit of what was talked about in that. I kind of want to talk a little bit to set this up on how the day unfolded today, because I always like to reinforce the literally hour-by-hour steps that we're taking with our COVID response in the city and in our counties here. About 6:30, sent a note to my teams, text message, and said, we got to keep an eye on the case counts today, because if the case counts show exponential growth again, we need to take some action. And we received information about mid-morning that there was another significant amount of growth in the cases in our city. A large portion of which were tied to Smithfield Foods employees. And so we decided that we needed to get together and take further action. So got together in our EOC on the other side of this room. We drafted a letter. We called the governor and her office and said, we're ready to do this and call on some stiffer actions at Smithfield. We think it's warranted. They agreed. And that's the result of why we're here today. So what I wanted to share with you today is the fact that we did send a joint letter to the leadership at Smithfield Foods probably about an hour ago, calling for a 14-day pause of their operations. And that would be ideally an extension of what they have previously announced. So the governor and I co-signed this, and I want to just really stress one thing here, that this is not an order. This is not a mandate. This is not a law. This is a set of recommendations, very strongly worded recommendations by the governor's office and myself. Before we did that, I also made sure that I reached out to Cooper Caraway. Cooper is the union rep for the unionized employees at Smithfield, to make sure that they were in agreement with this action. And he was very appreciative that we were taking this action. It's always important when you have a unionized workforce to make sure that you're doing what's in the best interest of those employees, and we feel that was done today. Now, this time, why 14 days? Why are we talking about 2 weeks? You know, this time is critical because it's going to allow employees to isolate from one another and give Smithfield employees a time frame that would allow for some adequate testing as is appropriate for this virus. So it's one thing to say, well, every employee should be tested before they go back to work. That sounds great. I could test negative today and be positive tomorrow. So what we do want to make sure, though, is that every Smithfield employee that is even remotely symptomatic or has been around anyone who has been symptomatic has the ability to get tested, get the results back, and then know if they can safely return to work. And when you're dealing with 3,500 employees, and also limited testing capacity, that takes a little time to pull that together. Thus the call for the 14-day closure at Smithfield. We're also calling on Smithfield to continue to further enhance their mitigation efforts, properly disinfecting workspaces, readjusting of operations, employee distancing, screening employees, many of which they've done a good job with already. And as I've mentioned before, what happens in Smithfield Foods is under Smithfield's control, but what happens outside of Smithfield Foods is not under their control. And so that's a whole nother piece of this growth that we're working with the employee bases on, to figure out how we can work with them on their home life to make sure that they're not spreading coronavirus in the residential units where they currently live. We're also recommending that Smithfield have full pay and benefits for their employees during this closure. That's really important. That's really important. I don't want to gloss over that, because closing that facility and what I'm asking there and what the governor and I have agreed to has significant impact, not just on the employees, but on the food industry overall, on the interruption in business operations, and getting those pigs that normally go to Smithfield are going to get diverted, and getting that re-diverted back when they open up. That all takes time and work. This is a significant interruption when you're talking about, I believe, the third largest pork producer in the country in Smithfield. But we do feel it's the right thing to do. And there's some data that's also driving this. As of today, our per capita data, we have 182.25 cases per 100,000 residents. That is more than Seattle, that's more than Chicago. That's concerning. That's very concerning. And because of that, we think this action is very prudent. Our current doubling rate is about every 4 days, and we've had that for about the last 16 days. So think about that, every 4 days, we're doubling the amount of cases in our city, and that's existed for about the last 16 days. So it's for those reasons and numerous others that we think this is the right thing to do. Remember, the number one priority, I've said this all along, is public health, Those employees are vulnerable in that plant. We need to make sure that their health is priority number one, and also that we're doing the right things for not only the employees, but the family members of those employees. That's just as important as the employees themselves. And so I asked Dave Fleechek, President and CEO at Avera McKenna, and Paul Hansen, President Sanford USD Medical Center here, to join me today because they are obviously supportive of this, but they also are where the testing capacity lives. There's a lot of testing that has been done and needs to be done with Smithfield team members. And so I'd like to first ask Dave Fleechek, as I mentioned, CEO of Avera McKenna, to address this issue as well. So, Dave?
All right, thanks, Mayor. And we at Avera, too, do support the actions that the governor and the mayor have recommended. Smithfield has been a great community partner, and the Smithfield employees are our friends and our neighbors, and we think that they should get this time to mitigate the risk. And so it's very important to us as we manage our surge capacity at both health systems. We just have to make sure that we have enough rooms at the inn, and that's what we're doing right now. We have a couple weeks here where the surge has not hit yet. We just want to make sure we have enough capacity to take care of the friends and neighbors that we do so, that we can handle that. As far as testing goes, we just, testing commodities, the test itself is a precious commodity. So we want to make sure we test the right people. We will definitely work with Sanford to create a testing site where we're both there. We still should follow the same guidelines. If you have underlying medical conditions is when you should get tested. We just shouldn't be testing everybody because it's a precious commodity. So something that we would work on next week with the state and Sanford and Avera could easily come up with a combined testing center should that be needed. So again, we do support the governor and the mayor here for the leadership that they're taking here. Again, our friends and neighbors need this, and I think it's important that we support a 14-day leave of absence. Thank you. Paul?
Thank you, Dave. I am here to deliver the message as well that Sanford also agrees with the decision moving forward that the mayor and the governor have made regarding Smithfield. Now is the time, for us to look at, what we can do for our community and how we need to work together more closely. And I will tell you, and certainly the mayor and the governor's office knows this, but the relationship that we have with our local providers, our competitors, who are no longer our competitors, they're our partners in this. We are moving forward. We have resources, as Dave said, they are not unlimited resources, but we have resources. We have competent people that are working this virus, that are working with our surge planning process at all of our facilities. I feel confident. I want you to feel confident as well. You have a job. Your job is to stay safe. Your job is to recognize the symptoms that occur in this virus. And if you're symptomatic, seek help. That's why we're here. If you're not, social distancing, as has been discussed for several weeks, is one of the best things that we can do. Please respect that. As far as testing goes, again, Dave alluded to it as well. We do have testing facilities within our organizations that are able to get test results back within a 24 to 48 hour period of time. Again, given the symptomatic nature of the patient that is presenting themselves. I would ask that if you're experiencing symptoms or you need a test, please call ahead. Please call ahead, to let us know that you're coming in. For Sanford, that's 605-333-4444. And I'll have to kick it back to Dave to get the Avera number. I don't have that one memorized just yet, Dave. The safety measures that we've put into place for our employees, our physicians, not only help our care providers, but they also help our patients. And I want you to understand and appreciate the fact that we are doing everything we possibly can to prepare for this surge. And I know that our partners are as well, too. I think that's what I have to say today, other than the fact that we are in extraordinary times right now. But we have extraordinary people here in Sioux Falls. We're caregivers, and that's what we do, and we are preparing for it, and we will be ready for you to the best of our ability. Thank you.
All right, thanks, Paul and Dave. We'd certainly entertain any questions you may have for myself or Dave or Paul at this time.
Have you heard back from Smithfield?
We have not.
Does this pertain to the entire plant or just parts of it? Or?
The entirety of the plan. That was also a little point of frustration in that the message was a 3-day closure. In actuality, it was portions of the plant that were closed, and so there was a little bit of I don't want to say misunderstanding, but when most people think of 3-day closure, they think it goes dark, and it's a significant operation. You can't just say, okay, we're going to shut off at 8 o'clock on Friday and open up at 8 o'clock on Tuesday with natural goods, meat basically, that has to be processed and dealt with. So that was a challenge for us to try and figure out and get around, and that's why we feel that while 3 days allows them to still get through their current inventory, 14 days, will provide a significant pause to allow them to get a good handle on this and the testing.
What happens if they maybe don't decide to comply with this suggestion?
Well, our hope is that they do. Considering the fact that our healthcare partners, our State Department of Health, and the city are all strongly recommending this, we have to look at what other legal authority then we may have on that. There's often, if I had $1 for every time someone sent me a message that says, shut it down, I'd be a millionaire. And it's not that easy. I'm here to tell you, you can't just shut it down. That's not how it works in a democracy. And so there are laws, there are rules, there are regulations, there's reasons. You don't just shut it down. And so that's why we're making these recommendations to Smithfield, very strong recommendations. And we're confident that they will listen to them and abide by them. And really asking them to be good corporate partners. Being part of a community involves being a good corporate citizen and a strong corporate citizen. And when the city is asking for something in a time of need, we expect our corporate citizens to step up and adhere to that.
Mayor, has Smithfield been a good corporate citizen? I mean, I'm sure most of us in this room on the journalist side have heard about these cases through the grapevine maybe a week ago, and now just the last 48 hours or so, we're finally getting numbers. Have they responded as you wish they would have responded?
I believe they have. They're taking it very seriously. They have executives from their headquarters in Virginia that are out here on site right now. They've really changed a lot of protocols already. So I'm not here to say that they haven't been listening or responding to the needs. They absolutely have. But sometimes that's not enough. And so while I appreciate the steps they've taken thus far, we just need to see some larger action today to start to, as we've said a million times, flatten the curve, which, quite honestly, is taking off at a greater rate than we'd like to see right now in Sioux Falls.
Mayor, we have some people outside who don't believe what Smithfield's saying. They're skeptical. What would you tell those folks just out the door here that protested the other night and maybe are going to protest later today?
Yeah, the question was, you have skeptics who don't believe what Smithfield is saying, that what they're saying publicly is not what's happening at the plant. What I would say is it's a unionized labor force. Okay, they have to be sure to feel that they're being properly represented on their work floor, and unions are there for a reason in situations like that. So they have to work with the union. Honestly, in the last 48 hours, I've gotten hundreds of emails from Smithfield employees, family members, sons, daughters, cousins, expressing some concerns to me. And so that was also a reason behind this. I saw the increase in cases, but I also saw the concerns that were starting to come in. I said, okay, I think we need to take some deeper action here.
You think there's any possibility that you could get someone from Smithfield here at one of these news conferences, since they're one of the biggest employers, certainly one of the oldest employers in the state and in the city?
That would be a hope. That would be a hope. We can certainly make that request. I can't speak for them on when and where they'll speak to the media on this situation.
That's
It's an
part of the
important
problem with us, seriously. I mean, we call and they say no comment or read the release. So, we want to do our job.
Yeah.
We want to report the facts, but it becomes difficult when, you've been very transparent, the hospital's been very transparent. We were one of the biggest hot spots in the country for a while, maybe still are.
I feel your concern on that. I share some of those same concerns. So, and the question was just making sure we have good communication with the Smithfield team, including to the media, who deserves some answers for the general public.
A lot of the employees at Smithfield English isn't their first language. What, do the healthcare facilities have interpreters? How are you guys explaining to these people what quarantine means?
You know what, I'll speak briefly to that, and then I'll let these guys address that. We work with organizations in the community. The Multicultural Center has stood up multiple languages. And the question, do I get to repeat the question? Is that, okay. She was saying Paul. I thought she was talking to me, other Paul. The question was, how are we speaking to the communities of different languages and different immigrant communities? Working with our Multicultural Center, we've translated dozens of languages of materials to get out in front of these folks. I even see our Hispanic News Network is here today, which helps with getting the word out to our Hispanic population, which the Hispanic and the Nepalese population are the two hardest hit right now in this. And so those are two languages we're really focused on. But I know the healthcare organizations have their own language translation efforts too. And if one of you guys want to speak to how you take care of that.
Yeah, so we have interpreters actually in the emergency room full-time now. We actually have printed material in about 6 languages right now to hand out is the best, so it's clear. And so that is a major concern with this specific population, just making sure that we're being clear and concise. And one of our testing centers this week got run over a little bit because people were confused thinking you can just get a test. And really, you need a doctor's order to get a test. So you do need to call your doctor, call the COVID hotline. They'll do an assessment before they'll order the test. So there was a little confusion earlier in the week about that we've cleaned up. So we do have plenty of interpretive services.
I'm going to echo what Davis said in terms of the resources that are available at Sanford, but I also want to point out that anything we can do within the community to assist us. There are some folks that will provide a telephone number that we will call, and the call goes nowhere. So we're working with that process in terms of making sure that whether the test came back positive or negative, especially in a particular hotspot, that we can track down that individual, either through a relationship that we have with their healthcare provider, their insurer, or the employer.
So that's happened.
It has happened, but I will tell you that we're working through that, and we're able to track those that has happened to us. We've been able to track them down.
So is there anybody that's got a test back that's positive that you haven't been able to locate?
There have been individuals, or at least one particular test that I'm aware of, that we are tracking down. Just happened this morning. So, I mean, it may have already been taken care of by the time I got to the press conference.
All right.
How do you make sure that these folks are quarantining once they get home and they're not going out in the community?
So that talks about the delineation of whose roles are what. And the State Department of Health is in charge of all the quarantining operations, the contact tracing operations. And so that would be a better question for the State Department of Health. They're in charge of making sure that the quarantine efforts are followed. You'll notice that the governor did create what's called a public health emergency in Minnehaha County and limited those powers to being able to judicially enforce people who aren't sticking to quarantine. So if someone's under quarantine because they have COVID and they're not abiding by it and they're going out and they can be arrested, they can be locked up. There's tools that the governor, that the state now has to essentially enforce those quarantine orders.
Is there difficulty with dealing with Smithfield when it comes to like the federal government saying that they want them to stay open?
Well, so the question is there difficulty with the feds saying that they want Smithfield to stay open? I had those concerns as well because those were relayed to me from Smithfield. I did make a couple calls to several folks at the federal level this morning to better understand that. The USDA cannot mandate that anyone stays open, a plant like this. So that was an important clarification for me. Because I think there was a little bit of a fogginess on that maybe when I talked with Smithfield. So again, not making assumptions. And I'll be honest, I went to Senator Thune and I said, I need some clarification on this, please. He made a couple calls this morning and got that information for me.
So you said that a lot of the assistance is coming from the unions here in Sioux Falls. What is your relationship with the unions, especially as it relates to Smithfield and who's employers right now?
Yeah, the question was about unions, relationship with the union. I have a really great relationship with their union head, Cooper, as I mentioned. So I've been keeping in nearly daily contact the last week with Cooper just to make sure that I'm understanding what he's hearing on the ground. Do the employees feel safe? Do they feel that they're being well represented with management? Do they need me to carry any messages for them on their behalf? So that's really important. You're seeing one of the times, one example of why a unionized workforce can be beneficial in a situation like this, especially when the population doesn't all speak the same language as the management. So it's been important.
You said we have per capita case rates higher than Seattle and Chicago. We've only had 33 hospitalizations, I think, is what I saw this morning.
Correct.
6 deaths. I mean, is that a silver lining to this? I mean, you don't want to see deaths
Absolutely,
at all, but
absolutely. Question was, we've only had a couple dozen hospitalizations on this thing. So why the nervousness? Why the tension? Why the Saturday press conference at 4 o'clock? Well, what we're trying to do again is this is a proactive step. We're taking these steps because on April 30, I don't want to stand up here and say that we've had dozens of deaths in our city because we didn't act properly on April 11. And so, yes, that I'd call that a silver lining, but we're trying to protect these guys' capacity so that we can treat everyone gets the care they need. And at that doubling rate that we've had, it makes us nervous. So that's why these steps are being taken, these recommendations are being taken.
Mr. Mayor, if a public health emergency has been declared for Minnehaha County by the governor, would she have the ability to order Smithfield to close down? And could the City of Sioux Falls Board of Health, could they issue a public health emergency and then order them to shut down? Maybe Stacy needs to answer that.
Yeah, the question was, can the governor order a closure of a business like Smithfield, or can our Board of Health? I'm not going to speculate on that because I don't know, Todd. There's some constitutional law issues that to work around, but that would be a state-level question if they have the authority to do that.
Could the City Health Board do that like we've done with some of the other ordinances on an emergency basis?
If there were health-specific issues, so that our health board felt they needed to enforce, but like I said, there's been a lot of compliance at Smithfield. Their hygiene practices are good. They're screening people, when they come into work. And so we did a visit there last week, and we were very comfortable with the practices that they had in place at Smithfield. Again, the problem we feel is not so much in Smithfield. Our hunch is that it's outside of Smithfield.
If you continue to see issues with the spread of it, is there like a shelter in place that might be done or looking into?
So the question was, could there be a shelter-in-place order? We have that in our county right now for folks 65 and over and vulnerable populations. As of this morning, I actually made a formal request to the governor's office to consider a shelter-in-place countywide for all of Lincoln and Minnehaha County. So they're reviewing that. They're looking at that, determining if that's something that they feel is right now. The governor and I had about a half-hour call on it today. And so it's certainly something that I personally would like to see, and I feel we're moving in that direction.
There's been 33 hospitalizations at one point or another for these COVID patients. Can you guys tell us how many people are in the hospital with COVID right now?
Yeah, I would say right now we're definitely not at a surge, but we are treating COVID patients as we speak. The number's been stable, I would say, this last week, so we haven't seen a spike in inpatient care. But to the mayor and governor's point, we really do want to mitigate the risk so that when the surge comes, we have enough capacity. I think both institutions, our hospital usually is full around 400. We're planning for over 800 patients. And so there's been a lot of work by our clinicians and staff to try to figure out how to manage that many folks. So we support this 14 days just to mitigate the risk. And as the patients start coming, it's really about PPE, personal protective equipment, and making sure that our staffs are safe as well as we take care of these patients. But yeah, so I'd say right now it's been stable.
So you expect that at the surge at peak, you'll have 800 people in the hospital at one time?
That is that
Read
is.
back, Dave, what the question
Yep.
was? Or-
So the question is, will we have 800 patients in the hospital at one time? Well, if you look at the East and West Coast, that was quite possible. They actually had more than they could deal with. So we're just trying to be prudent and think through this so that we can take care of the patients that come to us.
When you say it's been stable, I mean, are we talking like 5, 10 people right now?
Yeah, I would say under 10 right now.
At both systems combined?
We probably have had more than Sanford at this point.
I'm going to
Yep.
jump in too. Yeah, I will agree with Dave that, the number of patients we've had have been under 10. The number of events, likewise, under 10. The surge capacity that we've talked about and the readiness, if you will, for those beds, we too are looking at a little over 880 beds that we would have available for this. As we look at those numbers, as I'm sure Dave would say the same. As you look at the 850, you look at our 880. Anything above that, obviously, operation, we both have concerns about how do we staff that. So what do we do? What do we create? And I will tell you this: our people certainly at Sanford, and I know at Avera too, that we've got great people that understand what we can do. How do we step this thing down? What's the most appropriate thing we can do for this type of surge? And I feel very, very confident with where we're at, preparing for that high point, that high surge mark.
So to clarify, it's combined, over 800 beds combined between health systems or each
No,
health system?
it would be each.
All right, any other questions?
Do you know how many workers will be left in Smithfield during the 14 days then, or?
There will be some, because, they operate their own wastewater treatment facility, for instance, in the plant. And even without the plant running at full capacity, that plant still needs to be operated. So it's a complex operation. And it's not like just shutting down an Arby's and flipping off the light and then opening up in 14 days. So we understand that. We're going to hopefully be able to work with them on that if they do, in fact, decide to take these recommendations and follow them accordingly.
When do you expect to hear back from them in answer to your letters?
The governor's office provided them with this. I would expect very soon, because we have planning that we need to make. This affects a lot of lives and a lot of families. And people need to know that when they say, shut it down, shut these places down, there are so many issues we have to consider and so many families we got to be thinking of with this. It's so complicated. And I've said it a million times, but you solve one public health issue and you create 3 other public health issues with every decision. And it's gut-wrenching decisions that we're making right now.
When that decision is made, is there going to be a press release?
Yeah, for sure. When Smithfield, if the question was if Smithfield closes and when will there be a press release, absolutely, that information will be very public. So,
Have you talked to CEO Sullivan today?
not today. I've not talked to the CEO of Smithfield today. Thank you for being here. Appreciate.
Okay,
Thank you. Yeah.
Just to clarify, when, with Governor Noem's emergency order.
Public health
for-
emergency for Minnehaha.
Yes, for
Yep.
Minnehaha.
Yep.
Should they not comply, what can the city do to reinforce that? If they don't quarantine themselves? What is the city's role in reinforcing that?
If they don't enforce the quarantine efforts, the question was, how does the city help reinforce the quarantine efforts? If there's 10 people quarantined and they're not listening to the quarantine, the public health emergency provides judicial powers to enforce that, whether that's through our police department, whether that's through the National Guard that comes in and literally could stand outside the person's door to make sure they don't leave to enforce a quarantine. There's a lot of tools at our disposal and the state's disposal who has the jurisdiction over that to enforce. All right. Thank you, everyone.